Hi everyone, it's board certified plastic surgeon Sean Doherty from Boston, and I wanted to speak about breast surgery today. So laxity of skin, that's looseness of skin, it's an issue for most people. And for women that are bothered by the shape and size of their breasts, it plays a big role in kind of determining what the right surgery is. For some people who have deflation and laxity of skin, putting implant in improves the shape and size of an implant. For women who have too large of a breast, reducing the breast and lifting up on the chest wall is satisfactory. But sometimes there's a combination of those two procedures, which is placing an implant and then lifting the skin on top of that. Now, we ask a lot of tissue to support an implant and to support the surgery. And so what are ways that we can make that even better and to support that breast and to reduce further laxity of skin? Well, that is use of a polymer, and it's a synthetic support system. It is called Galaflex, also known as P4HB. It's a polymer that's bioengineered and similar to some products that we have in our body, and it's used successfully in conjunction with some breast surgical procedures. So this is what the mesh looks like. And again, this is a temporary absorbable mesh that is placed in the body to help support breast tissue. So if someone was to have a mastopexy augmentation, that's a breast lift with an implant. Breast implant sits here on the center of the chest, and then tissue is organized and tightened over that. Well, putting that implant in could actually lead to more laxity of skin with time. So adding this support mechanism here, putting this mesh in, allows support in the healing of that first year, and then ultimately this tissue system gets absorbed, and then your body creates stronger, more healthy tissue that lasts a lot of time. So this gets tacked in to the chest wall, supports the implant at the time of surgery, and it's very successful. Again, this tissue does not stay forever. It ultimately gets absorbed, so it's not a permanent thing, most like sutures that I use in the operating room. In some cases, people have a large amount of breast tissue and need extra support for just a reduction or a lift. This actually can be placed on top of breast tissue underneath the skin to give further support. So again, this is called Galaflex, known as P4HB scaffolding. And it's a really interesting way to think about breast surgery. So I hope this was helpful. If you have any questions or interests, please let me know. Thanks.